Good morning. In this episode, I will explain exactly what endometriosis is, so let's get started. So what is endometriosis? Endometriosis is a condition where tissue similar to the lining of the uterus is found outside the uterus. Now, in the past, there were theories about what might cause this condition. Some people said, well, maybe, rather than the tissue from menstruation leaves the body, it stays in the body. Whereas surgeons who have performed surgery on this patients, they found that no, they took the lesion, sent it to the hospital lab. The hospital lab technician takes a look at it, and they both realized, no, this is not the same as tissue found inside the uterus. So the tissue is similar, but not the same. So the retrograde menstruation theory does not hold. So what doctors are thinking is probably patients with this disease, they are born while they're in their mother's body. Those tissues are forming already outside the body before the baby is born. So that's the current theory today. So the symptoms vary from patient to patient. Pelvic pain, heavy, painful periods, painful bowel movements, painful urination, infertility, other symptoms. So you can see if this is a disease where every patient has exact same symptoms, exact same severity symptoms, then it's easy to diagnose. But this one, each woman has different symptoms and different severity symptoms, so that's even more complicated to figure out, is this normal monthly pain or is this something serious? So each person experiences different set of symptoms, and some people don't have any symptoms. So some women, they have surgery for unrelated condition. They're diagnosed, and the woman's like, no, I never had any painful periods. So yeah, that's another complication. Just because you don't have symptoms doesn't mean that you're healthy. Yeah, so some people have varying degrees of pain discomfort. As with many other chronic medical conditions, this disease is caused by a combination of genetics and environment, so a specific set of mutated genes make it more likely to develop the full-blown disease. However, some patients have the genes but not the full-blown disease. So the gold standard to getting a proper diagnosis is surgery. However, most patients, they cannot afford to pay for surgery to get diagnosed. So that means a lot of women who have this disease, they don't get diagnosed because they can't afford to pay for surgery. As a result, the exact number of patients is unknown. There is a movement to find another more cost-effective way to diagnose this condition. One possibility is, I misspelled possibility, is an MRI. However, that's also an expensive option. Most patients cannot afford an MRI to pay for an MRI. Keyhole surgery is another option. However, again, the surgeon needs to be specifically trained to locate and identify the characteristic lesions and adhesions. There is no known prevention, no known cure for this disease. Treatment plans include medication, which costs less than surgery, but medication has risks such as side effects, increased risk of cancer. There's one drug, you could probably Google this, I won't mention the drug's name. It has worked very well on endometriosis patients. However, one by one, these patients are being diagnosed with cancer. So yeah, so now there's a lawsuit going on about that. There's also pain medication, but again, There's an increased risk of liver damage, habit forming. I know with street drugs, they're called drug addicts, but with prescription medicine, they use a euphemism called habit forming. So that's also a risk as well. Surgery depends on the severity of the disease and the knowledge and training of the surgeon. So just because a surgeon says, hey, I specialize in endometriosis, that doesn't mean that that's the right person for you, because maybe you have a complicated case, maybe ovaries are involved, maybe it's even up in the diaphragm, umbilical cord, a belly button, lungs. So yeah, it depends on the knowledge and training of the surgeon. So there's barriers to getting medical care. Stigma about being female. It's like, oh, it's all in your head, woman. The word hysterics come from the word hysterectomy, same word that comes from hysterectomy. So yeah, so having female health concerns, it's a taboo. You don't talk about these things. Race and ethnicity, and again, only people who can afford surgery will get diagnosed. So at first, people thought only white women get this disease. Well, only white women can afford to pay for surgery. So obviously, African Americans, Native Americans, Indigenous Californians, Asians, Asian Americans, Latin Americans, Middle Eastern, they're not going to get surgery, so because they can't afford it. And then the cost of surgery, just to name a few. Future considerations: more surgeons need to know and understand this disease. This is not one of those rare diseases such as cystic fibrosis. 10 to 50% of women have this disease. So the fact that my surgeon said I was the first endometriosis patient, that's like, really? You went to medical school, you did not know? Just... And while I was recovering for surgery, the surgeon says she encountered the second patient who has endometriosis. So, and then maybe that's the reason why it's called, air quotes, practicing medicine. They're learning as they go. So, unfortunately, I guess that I was a guinea pig. She never encountered a person with endometriosis. So, yeah. Even today, I had my first surgery 15 years ago in October. We don't have a specialist. I mean, we do have like infertility specialists who kind of sort of know, possible causes of infertility, one of them being endometriosis, but that's not all they do. They also treat people who have a polycystic ovary disease, or maybe it's both. Both the husband and the wife are having problems conceiving. So yeah. I had to go all the way to the San Francisco Bay Area for my second surgery with a specialist who knows what he's doing, and now I'm pain-free. Yeah, so we still have a long way to go. So more training is required to bring all surgeons up to speed on modern laparoscopic techniques, as well as how to identify lesions and adhesions. So what can you do? You can raise awareness. Donate to your country's endometriosis association if you're financially able. Most importantly, know that any monthly pain is not normal. I participated in the research that saw, there's a specific set of mutated genes that a woman with endometriosis has. But there's also an environmental component as well. So next episode, I'm going to talk about what happened in Seveso, Italy, back in 1976. So questions, comments, constructive criticisms, let me know. And I shall see you next time. Take care. See ya.